All right, Erin, so St. Luke's, it's launched a new center that is changing the way patients can receive a cancer diagnosis, see an oncologist, and begin treatment. Dr. Timothy Pluard, medical director of St. Luke's Cancer Institute, explains.
The Cancer Diagnostic Center is developed to address a need that we identified where patients who had suspected cancer often took weeks seeing multiple different specialists to ultimately obtain a definitive diagnosis that they have cancer or do not. And so that's a very unsettling time for those patients. And we thought that we could streamline and expedite that process by bringing together oncologists, diagnostic physicians, and try and get the most efficient means of a diagnosis. And so patients can obtain a diagnosis in a week from referral. So that alleviates a lot of anxiety. And we know from experience that about 50% of the time it's not cancer. But for those patients who ultimately do have cancer, it shortens the time between the initial suspicion and ultimately diagnosing and treating that cancer. Typically, patients would be seeing a variety of different doctors trying to obtain a diagnosis before they actually saw an oncologist. We're kind of flipping this, and they're seeing an oncologist up front in the Cancer Diagnostic Center to kind of guide the diagnostic evaluation in a more efficient manner. We've launched the same-day new patient appointment because one of the most terrifying times for a patient is receiving a diagnosis that they have cancer and yet don't have a plan. And the anxiety and the uncertainty surrounding that will often be mentioned by patients as one of the worst times of their journey. Patients who are newly diagnosed, if they contact the center, will be seen the same day. We understand we may not have a final plan on that day, but we will have a plan to get to the final plan, and we will be walking alongside the patient with them.
For more information on St. Luke's Cancer Diagnostic Center and same-day scheduling, go to stlukeskc.org/cancer diagnosis.